here we are, phase 3, Brigham and Women's Hospital, 3:19 on the 20th of September.
Yes, lovely view.
Peggy's here with me. This is my room for the next however long it
4
takes.
weeks.
Nowhere near as good a view as in Portland. Just
Nowhere.
some whatever.
Yep.
So here we are. Got the old central lines put in. Very uncomfortable. But we're off to the start. Off to a good start. This is the next step to beating this. Woo.
We're weird. We do little documentaries, usually about our travel, but this is our adventure this year.
Yeah, exactly. Document what you can.
So, Friday, September 20th. It has been quite a day. And I'm not gonna lie, as they say, it hasn't been an easy day. So, Friday, September 20th marks my admission here into the Brigham and Women's Hospital in Boston. We came down last night, stayed in Brookline at a hotel that Peggy's going to be staying at for the duration of my stay here. So that made it easy. Stopped at Trader Joe's, had just bought some frozen meals, ate in the room. That was good after a short walk. And got up this morning, came in to Farber. First thing was labs, had some blood draws, went over to admissions, got my provisional admission, and then went to have my central lines put in. These central lines will be where the blood's drawn daily and where the medications are given, and then where my stem cell transplant ultimately is administered. So that was very interesting. It was long, several hours. General anesthesia or conscious sedation using fentanyl, which I found very interesting. Fentanyl is a narcotic, fast-acting pain medication. It's been used medically for decades. Most people know about it now due to the abuse of it on the streets, of course. One of the technicians didn't find it funny when I suggested to him that I stopped on Com Ave here in Boston, get my own fentanyl. He didn't think that was funny. I thought it was funny. The nurse thought it was hilarious. So I got through that procedure. I went and had some lunch, which was nice, across the street. Really nice meal over there, actually. I forget the name of the place, but it's almost all vegan stuff, and it was delicious. Came back to admissions and waited, got a room around 3 o'clock, 3:30. Came up to the room. My room is Tower 4B35. So tower is the name of the building. 4 is the name of the floor. B is the section of the 4th floor, and room 35. A lot of waiting around. Got some vital signs taken. Sort of figured out the room. The room's nothing special. Not like Maine. I don't have any floor-to-ceiling windows with views of the city. It's pretty small, but it's adequate. It's a lot older than, of course, the brand new facility at Maine Medical Center. Met the CNA. Met the nurse and the student nurse. Maddie and Alana. CNA was Shirley. And it's 9 o'clock now. I haven't met the night nurse yet, interestingly. I expect I might get interrupted at any moment. But, yeah, kind of a heavy day, to be perfectly honest. And these, probably 2 hours ago, these central lines drove me to tears. I was in a lot of pain, a surprisingly large amount of discomfort and pain, to the point where I really had to ask for pain medication, which I don't like to do. Asked for some Tylenol, thought that might take the edge off of it, but with the chemo I'm having tomorrow, I can't have Tylenol. And so they asked if I wanted a narcotic, an oxycodone, I think is what it was. Kind of refused it at first, and then I got to the point where I had to. I was surprised by it and kind of overcome by it, and it was the most pain I've had in a long time. Still hurts, but my pain from a scale of 1 to 10, 7 is now probably a 4, 4.5, maybe 5. So it's much more manageable, and I've got a little more flexibility in how I can move and look, so that's helpful. But yeah, that was tough. It was surprisingly tough. Got a shot in the belly to avoid blood clots. That's always a medication that stinks. So I'll get interrupted in my sleep at 11:30 tonight to get vitals, and then 5 o'clock in the morning to get vitals. And then I start chemo tomorrow. Not looking forward to it, but part of the process, obviously. I've got plenty to read. I'm reading 2 books right now. I'll get those in. I've got videos to watch, so I've got enough to keep me busy. Got a fridge in the room, which is nice. And that's pretty much the first day. So I'll call this day 1, Friday, September 20th at Brigham and Women's Hospital. Long day, tiring day. I'm looking forward to going to bed here in a little bit. And I guess we'll check in tomorrow. Oh, IV time. Getting ready for chemo later this afternoon. Oh, you're just flushing right now, right? And for the record, I'd rather have a bone marrow biopsy than these things. These things hurt.
Good.
Okay, thank you.
Poisoning begins. What's that?
95 feet.
Yes, it is.
Oh, here we go, day 3, Sunday, September 22nd. Fully on the chemo regimen. There's 3 bags of something hanging from the IV stand here. I get 1 type of chemo 24 hours a day, and then There's another one that's like every 6 hours or something like that for 20 minutes. I wrote them down somewhere. The one that they had every 6 hours is actually the first one I've had where I can actually feel it when they start going in. It's kind of weird. It's hard to describe. So yeah, day 3. So today is Sunday, so I'll have chemo all day today, all day Monday, Tuesday, and then the last treatment will end at 6 a.m. Wednesday, I think is when it is. Side effects are good. They're managing them well. No nausea, knock on wood. Definitely feeling tired. It's hard to walk here. The place is so small. I just get up and, you can walk basically 100 feet one direction, 100 feet back. It's tough, but I'm getting up and doing that. Staff is good. They're fine. Food's okay. Not really much of an update today on day 2. Numbers are on the way down as expected. I looked at my labs this morning. Be nice if they didn't interrupt me every 6 hours, especially in the night for different things, but I think I got some sleep last night, which is good. Sporting the DDX 41 jersey today. No one's noticed yet. That'll be interesting to see if the doctor says anything. So yeah, nothing much. Reading the book The Scientist, reading Blink by Malcolm Gladwell. I've got a new book that my friend Jeff Lith sent to me to read. And some notes I want to put together. So yeah, one day at a time. Days 1 and 2 in the books. As somebody said online, won't be long before I'll be looking back on this and saying what a pain in the neck. It is Monday, September 23rd. That makes it Friday, Saturday, Sunday, day 4 of this round, day 4. Although, so I guess that makes it day -3, right? Yeah, -3 before transplant. Sunday, yesterday, just chemo. It was one of these that I get that is the first one that I can actually feel it when they start it flowing. As previously mentioned, the Zofran is preventing nausea and vomiting. It's also preventing me from pooping at all. So that's starting now. So two full days, 48 hours since my last poop. I ask the nurses all the time, I'm like, did they tell you in nursing school you'd be talking so much about poop to your patients? So, yeah, I get a full day again today and tomorrow of those 2 bags of chemo. And then today and tomorrow. And Wednesday morning, I believe, it ends, because that'll be Saturday, Sunday, Monday, Tuesday, yeah, Wednesday morning, and then I'll have like 24 hours off before transplant. Not much else. Showered yesterday, that was lovely. Make some coffee, having my protein shake the first thing this morning. Peggy had dinner with Olivia and Saray last night. I've pretty much just been reading. I'm reading 2 books concurrently. Continue to read on those, and then got a couple of podcasts I want to listen to. a couple of other books to get started on. So that's pretty much it at this point for my vlog, my video log. Peggy put up some lighthouse calendar photos yesterday. Adds a little bit of something to the room. So yeah, that's it.
D minus 2.
2 diplomas. 2. Ella llama cuando nosotros desayunamos.
There we go, 97.7.
Good. I'm a little shaky too.
Today is day minus 1. Your chemo is done.
Oh,
Woo!
that bag's got to finish.
No, that is not chemo. He said you were done. I asked the nurse.
Oh.
That's not connected. He said you're done. This is your rest day.
Okay.
So how are you feeling?
I feel terrible. But
You're
I have to be here to make the stem cells work. I'm shaky today. I might actually eat something today.
you're much better than yesterday, but
Yeah,
you're
yesterday was ugly. Last night was ugly.
very hyper today. Do you want to talk about what happened earlier? Or?
What are you talking about?
What you saw?
No.
Okay.
You can say it. I can edit it out.
Your apparitions. And
No, I had some hallucinations that were a side effect of one of the medications. They took me off of it. That was it. So,
and it still kept you a little bit hyper, he said, so that'll wear off. But you're up and around, and that's really good.
yep.
Yay.
Oh. So today is Thursday, September 26th, 2024, and it is actually day 7, which really means it's day 0 because today is transplant day. Woo, yay! I get my stem cells and my other materials sometime later this afternoon. It's currently 3:45, so it's obviously running later than what they had thought, but that's next on the agenda. Room with the nurse was just in for the 4 o'clock medicines and check on everything else, and flushed a couple of my central lines. So the last couple of days have been difficult. Not getting much sleep is a big part of the problem. I wasn't getting much sleep for a variety of reasons. One, you don't feel good. Nothing's appetizing because the chemo changes everything in your mouth. The food offerings at this particular hospital leave a little bit to be desired, or a lot to be desired, as the case may be. And, I've got a little bit of a reserve ring right down here in my belly. I'm not that worried about it. And I just didn't want to eat because I didn't feel like it for all those reasons, and I didn't want to have something in my belly to vomit. Because I've had 3 rounds 3 rounds total of nausea and 2 with real vomiting that were really, really uncomfortable. So I really wonder if that's a mouse up there.
No,
What do you think it is?
I don't think I said anything. Like this?
No, there's a way I do it.
Oh, okay.
Yeah. So like, if I do it all in one side the same way, then it twists all to hell
Oh.
when it comes out. Don't believe for a second that me doing it this other way doesn't mean it's not all twisted.
You did the temp already?
Yep. Yeah, vitals are all good.
Young blood. Young cells.
Good song.
72 drops per minute.
Here it comes.
Coming through. Woo!
There it goes inside.
We're ready if you're ready.
Okay.
Yep. Recording. How do you say goodbye in German? Should have looked it up.
Oh, wait, bon voyage. No, that's France.
You wanna look it
Octone?
up?
Is it octone?
I don't know. Tons of tension.
Oh.
I don't remember how to say goodbye.
Goodbye, little
All right.
German girl. Thank you for what you did.
Here we go.
Now we flush.
Now we flush. Get another one.
Auf Wiedersehen.
There you
Wiedersehen.
go.
Auf Wiedersehen.
Wow.
I knew it.
I didn't know that one.
I knew that I knew it.
Oh, you probably learned it when you were on your own while I was in my conference.
No, I learned it
No?
watching Hogan's Heroes.
Oh. Good, Steve.
All right.
Okay.
That's all I got.
Need a final set here? Or?
Yep, we're gonna do a final set of
I
vitals.
figured as much. Hey, it is Friday, September 27th, 2024. This is my 7th day in a row here at the Brigham and Brigham and Women's. It is my seventh, it is the end of the 7th day of my stay here at the Brigham in Brookline, Massachusetts. Last night was a big night. I got my transplant finally, after 6 long months of fighting this cancer, learning the diagnosis, and then starting on the journey to getting this thing eradicated. The chemo in Maine, the chemo here. Last night, the big breakthrough came with the stem cell transplant. That was super non-eventful, which is great. That's kind of what we want. You know, for me, it all changed with the DDX41 mutation identification. And that mutation let us know what was going on, where the cancer was coming from, the likely paths that it would take, the historic references to treatment plans. And so that put me in a really good position, aside from being the very typical white male of European descent in his early 60s comes down with. So if you're not getting your labs and your annual physicals, do it. That's how I got caught. That sounds kind of funny. That's how it got caught. Right? I had a primary care physician that was paying attention to the numbers and said, you need to go and see somebody besides me because these blood labs are leading down a path I don't like. So I'm super grateful to Dr. Badilla at Yarmouth Family Medicine in Yarmouth, Maine. But the transplant itself, again, was pretty much nothing special. It was a blood transfusion. It was amazing. I mean, they harvested this blood from this 22-year-old woman in Germany on Wednesday, and then flew it yesterday, Thursday, and it may even have been yesterday morning, with the time change. She may have gone in, she'd been taking the medicine for the week prior. They harvest those cells off and send her on her way, and I get her blood, and she's saving my life, which is pretty amazing. So if you haven't joined the registry for bone marrow and other blood product donations, please do so. I'm no longer eligible. So yeah, we finished the chemo on Wednesday as planned, and then last night, and it was night, the cells getting here were delayed by commercial flight traffic, and so it was 9:15 p.m. last night before the cells got here, and at about 10:25 p.m. Eastern time last night on Thursday the 26th of September 2024, they started and opened that bag of blood products from a 22-year-old female in Germany, and about 33 minutes later it was empty, and we came back up to the room, and I came back up to the room. Peggy headed to the hotel, and it was done. Didn't really feel anything, which was good. I really felt nothing other than I felt better, because I'd been having a rough set of days from the chemotherapy, so it was nice not to have any terrible reaction. Obviously, it was nice not to have any life-threatening reaction, so we're in good shape. We're in good shape going forward. So I'm looking forward to a good night's sleep tonight. I had a rough night last night between the constipation and the complete, total lack of any kind of appetite, and just being exhausted from everything that's going on. I was really looking forward to it, and unfortunately, I had some of the very active dreams that I have sometimes. I've been a somnambulist my whole life, sleepwalking and sleep talking, and I got up a couple times and set off the bed alarm that they had for me because they were concerned about falling risks following the transplant, and just had a very, very long and bizarre dream that just completely confused me for the rest of the day. And I even looking around the room here tonight, I've been here this is my 7th night, and it still feels like it did in a different place in that dream last night, so it's very interesting. So it's time for me to go to bed. It is 8:43, and I'm going to go ahead and go to bed, hopefully get a nice night's sleep, as I mentioned before. I really appreciate everybody who's reached out to check in on me and to offer support and encouragement and words of faith and words of support and words of meaning. It means a lot. It truly does. So thank you all for doing that, and I look forward to seeing you all in person in the next several years. So this little blue dot's not really anything special unless you have relationships to experience it with. So for now, see ya. Let's see, Saturday, September 28th. Day +2 since the transplant. So that would make it day 9, I think. I'm not sure. That doesn't really matter. But today, I thought I'd talk about Today's featured side effect: fatigue. I went to bed last night like 8 o'clock, and I slept over 10 hours. Didn't even have to get up in the night to pee, that I remember. Got up, went for a walk, read for a little bit, had my coffee and a protein shake and had some breakfast, and then took a nap for over 2 hours. So I was obviously very tired. Very tired again tonight. I had a short nap this afternoon, which was good. Read a lot today. Reread some of the parts of the Hallnagel book that I had read before, but obviously don't remember. And there were no markings and no highlighting anything, so that was a good sign for me that I could tell that I hadn't really paid much attention to it, despite maybe reading it. So yeah, today fatigue is the only symptom that I'm having. I feel okay, you know, like this is deep muscle fatigue, like holy cow, I'm run down fatigue. As we were told it would be. It's not unpleasant, it's not uncomfortable, it's just being really tired. Tomorrow I get my first dose of post-transplant chemo, and they tell me I begin the road to diarrhea. They say it's very common. So, but I did have movement today, all good, and things are going according to schedule. The very sharp declines in all of my blood labs, as expected, as planned, which is the whole purpose of doing the conditioning chemo, is to drive that down. I was a little shaky today as a side effect as well, but you know, considering I have a brand new immune system, you know, the only really major signs and symptoms of that is the fatigue, and I'm having what are called visual migraines, and the only reason I know this is that I had a couple in the last year where it looks like I see a flashing in almost a prism. When I had it happen the first time, I called my eye doctor, and she said, "Get your butt in here right now." I was like, "Wow." She explained it to me as a migraine that the eye and the optic nerve have, and she said it is important to come in because that's one of two causes. The other cause means you go right into surgery. So I had another one last year, went in, same thing. So I'm obviously recognizing that as the same. They're not anywhere near as intense as the ones I had at the office in Auburn. But I did, now that I think of it, forget to mention that to the doctor when the doctor and the PA were in, so I gotta remember to do that tomorrow. So, but other than that, day +2, things are going good. One more day gone by to get me closer to having a properly functioning immune system and be able to return me to the lifestyle that I desire rather than sitting in a hospital room 24 hours a day. Okay, see you tomorrow.
So the first thing I'm giving you is just saline. And then I'm giving you Zofran, which is the anti-nausea medication. Okay, you can put your shot right there.
It is day +8 or 9. I'm actually not sure now. Saturday, October 5th. It's been a while since an update. So let's see. Thursday would have been +7, Friday +8. So yeah, it's +9, right? Anyway, I'm pretty much in the nadir. I have been here for the last day and a half or so. The nadir defined as the low point, the point at which my blood labs are all approaching or at 0, particularly the white blood counts. The point of maximum impact of the chemo, getting everything ready for the transplant. The point where my energy is the lowest, which it absolutely has been. The point where I feel the crappiest, which I absolutely have. The point where the mouth sores come back. I've got a mouth sore here that's awful, one that's here that makes it a little hard to talk, actually. Spend a lot of time laying down, more so than normal. Today my platelets have reached a point where they're so low I need to have a bag of platelets hung, so I'm hooked up to the IV getting platelets right now as we speak. Diarrhea, nausea, all the stuff. Stuff's got to get through to get to the other side. If I remember right, when I had the platelets in Portland, that marked a kind of a changing point for me too, that infusion of platelets. And I think I got some whole blood or red blood cells, I can't remember. But that made a big difference and was kind of a shot in the arm, in the body, so I'm hoping that happens this time to get out of this. So yeah, it's Saturday, October, what does that say, 5th? I'll put my glasses on and see. Yep, October 5th. I may have said 3rd earlier. It's 8 a.m. here in Boston. Yeah, not much to update. I'm just trying to stay positive. Thinking about, what's next, what the improvement's going to look like, hoping that it starts. Looking forward to it starting. And Dr. Seufer was here before he left. He leaves for his trip for Africa today, actually. He actually mentioned a date for going home, so he's continues to be optimistic that this is working the way it's supposed to be working, which it's been very consistent with how it was described, I have to say. So that was kind of a nice thing to hear, was him talking about a date to go home. So we'll see how that goes. I noticed that there is a date in the charts, the online charts, not my chart, but the other one, Gateway here. That one's pretty flexible though. So yeah, here we are. Looks like we're in the nadir. My white blood counts are like 0.02 or something. They're practically at 0. My platelets were at 8,000, so that's why I'm getting that infusion right now. But hopefully I'll feel better at the end of the day, and at the end of the weekend, and going into next week, things should start to go the other way here this week. I'm on an upward climb, and I'm optimistic and hopeful that my recovery here from this will be as robust as it was in Maine, as it was frequently described. It's like once I turned the corner, things took off, and optimistic that for no graft versus host disease. That's day 100 is the key for that. And we'll just get through it and move on. Till next time.
Today is Wednesday, October 9th. It is day plus 13. I'm just having some dinner and watching a Camino de Santiago video. The more significant of those two statements is that I'm having some dinner. This is the first solid food I have eaten since Saturday at noontime. As it was Saturday that I entered the nadir for real. I am still technically in the nadir, which, as I think I've discussed, is the low point of the process. It is the point where my body has received the maximum impact it's going to get from the chemo and the presence of the new stem cells are being supported and hopefully finding their way into the voids in my bone marrow to be creating new, healthy, cancer-free blood cells. That is obviously the goal. There's a lot to that, as you can imagine. And we had a good explanation going into it, but it has been, a lot to it. So today I'm hooked up to 3 lines. Sometimes it's 2, sometimes it's 1, sometimes it's none, which is, those days are nice. I actually have forgotten all of what I'm getting. I also get a shot in the belly. Some nice, really dark purple here on my fatty belly. The shots the sub-Q shots I get there every day are to support engraftment, support the new blood cells engrafting in the bone to create the new healthy cancer-free blood. As you can tell, I have the hiccups. I've always found the hiccups to be somewhat annoying, I think, as we all do. But let me tell you, having hiccups for 8 hours, 9 hours, 10 hours during the day is exhausting. So hiccups are a side effect of the engraftment process and everything I'm going through, and side effect of maybe the drugs. So much so that there's a medication for it. My dose at noontime is clearly worn off. Part of the hiccups also is that I haven't had any food in my belly for 2.5 days. And so my belly is throwing a few fits at me. I actually had some applesauce this afternoon when it became apparent that I could probably get it down and then likely keep it down, which has been so far so good. Working with the applesauce. I actually had early this evening, my first kind of pangs of hunger in my belly. So I figured I'd give the old noodle soup a try, get some protein, get some carbohydrates, hopefully get it to stay down. I do have these spasms from time to time, which are quite uncomfortable, where I'm not entirely sure if I had something in my belly, whether it would remain in my belly at the end of the spasm. It's kind of one of those. So I'm eating slowly. I've got just about an hour in now on this cup of ramen noodles. It's actually starting to get cool. My tongue and mouth have improved dramatically in 2 days, but they're still a mess. I've got a new sore on the inside here, old sore here, a new sore over here. The tip of my tongue is very, very sore. And the base of my tongue is very, very sore, along with the back of my throat. So, and not to mention my temporal mandibular joints. Holy cow, are they sore? Earlier I had to reach into my mouth to get a piece of food, and holy cow, my TMJ took off. So I'm doing my vlog, and my nurse just walked in, so I'm gonna pause the vlog for the time being, unless she wants to star in tonight's episode of the vlog of Steve's cancer journey. I'm pretty sure, she's ignoring me completely. She's such a professional.
I didn't know if you were talking.
I'm gonna turn this up. What am I getting, Jess?
You are
Wait,
getting...
you're Jess, right? Did I get that right?
you are.
Yes, I got the nurse's name right.
You're getting a cyclovir through
I'm getting
your IV.
A cyclovir, not to be confused with B or C cyclovir.
Cellcept.
I'm getting Cellcept, which is an enhancement to my transplants if I remember this, correct me if I'm wrong, if I get it wrong, it said a drug to support the transplant and the engraftment of the new stem cells. And my third line will be filled with,
That's for later.
oh,
Nothing right
later.
now.
Oh, nothing right now,
Yeah.
so I'll reduce the amount of intravenous fluid. So the anti-hiccup medicine has worn off.
Oh yeah, do you want me to grab that?
That would,
Think you'll be able to take it?
I am, yeah, I'm actually eating if you,
Okay.
yeah, which
good.
has been great. So, yeah, if I can get
Sure.
another dosage of that.
Yep.
It worked really well this afternoon.
Good. And you still doing the nystatin mouthwash, the yellow?
No,
No.
that I just can't.
That's okay.
It's gnarly and disgusting. That was not, that was not for you. That was for
All right.
the blood.
And then I have Actigol,
And I'll have
And-
Actigol,
Zydus, the one that goes under your tongue.
Zydus. Yep, one under the tongue. And then at some point, some more pain medicine as my combination of.
I'll ask the doctor about the Tylenol.
Yeah, no, I'm not going to ask for it again.
Oh, you just want
I
Dilated?
I wanted to do it as an experiment because
Yeah.
last night when the, what is it, how do you say that, Dilatin?
Dilaudid?
Dilaudin
Yeah.
was administered, and then my fever broke, or my fever spiked, and I got the Tylenol. I experienced this like 30-minute window where my mouth didn't hurt at all.
Yeah. That's good.
And so today, I convinced my day nurse to call the doctors and say, can we?
That's me.
Oh, it was you. Look at
Yeah.
me. I'm losing my mind.
It's okay. I came in early tonight.
And it worked, and it's
Yeah.
allowing me to eat. So I'm
Good.
not going to press my luck on that because,
Do you want me to grab the Dilaudid now with your baclofen?
yes, let's do that at the same
And then,
time.
are you
That
still
would be
doing
great.
this, the mouthwash, the
Yep.
Captisol? Okay.
Yep.
Do you want it on your table?
Anywhere that's convenient for you works for me.
Okay.
The nurses here, if I haven't mentioned my videos already, are very nice, very good, very professional, very helpful.
I'll be right back, okay?
Okay. So I'm going to wrap this one up. I'm glad to be eating. I'm not looking forward to the other end of eating in the morning. I am going to probably ask for the anti-diarrheal medicine because that's been gnarly. But my numbers on my charts have not only stopped, of course, white blood count went to 0, you can't go any further than that, but they've all made the turn and are headed up. So the attending doctor, Dr. Ho today, actually proposed this coming Sunday as a possible go-home day. So I'm thrilled at his optimism, and I'm skeptical of that being realistic given the way I feel right now. The fact that this is the first real meal I've eaten, and the fact that I can't drink anything other than sips of water at a time. But I like the optimism. So again, Wednesday, October 9th, day plus 13. We'll see you on the next one. Punched me last time. need me this time.
This is off the record.
File a complaint.
Alright, perfect. That's good. Let's hook up to him. So you see how it's already got the blood in there?
Yeah.
You just make sure you unclamp everything. This is open. That's open. We know that. This is clamped. It should still always be clamped, and then you can start. And then 15 minutes. We'll come back. Yeah, this will ring in 15 minutes. You've already gotten blood, so I'm not too worried about you getting a reaction, but never say never in this case. But
So you wouldn't find it funny if I was looking at you and went,
I would probably have to
okay.
shake you awake in a
Okay,
way.
I won't do that then.
And then, how is your swallowing? A little bit better?
No, it's the same.
Okay.
I'll work on that.
No, take your time. I'm just checking on it.
The swelling and the inflammation back there is way better than it was. It is Monday, October 14th. Day plus 18 from transplant. and day 24 overall in hospital. Tomorrow, I am going home. My labs have reached the threshold to allow me to go home. I'm still having diarrhea, great side effect of all of this. Still have a messed up mouth and sore throat, but it's getting better every day. All part of the process and the procedures that are going on here, but it's good that day 25 will be my last day here, and that actually matches day 25 in Maine as well. So this morning I'm just hooked up to a single IV. I think I'm getting magnesium sulfate, if I remember right. Yeah, magnesium sulfate. I get that for an hour because I'm low on magnesium. I think I'm low on potassium. That's the other one. So I got all my cards from my crazy mother, sending me a card every day, and a card from a couple of Andy's boyfriends, 2 little girls. That was very nice. But nothing fancy about the room. It's been what it is to get me through all of this. So yeah, the days and now weeks since transplant have been quite difficult, to be perfectly honest. I think I was prepared adequately for what I could expect, but it's been freaking hard. So the diarrhea and the drooling and the mouth sores and the what is it called? The lining coating the inside of my mouth and throat and into my stomach, creating all the GI issues. They have been all difficult. Sleeping's been tough. Swallowing this past week's been very difficult. In fact, I'm not going to talk much longer because talking actually inflames the back of my throat. But I have started eating regular food. I went like 6 days without eating anything solid or drinking anything because it hurt too much to swallow, which is not good, but it is what it is. So I'm back to able to get all my pills down. The only IV interventions I'm getting now are magnesium and the potassium, and those are being changed to the pill form, which I'll start either tomorrow or Wednesday after I'm home. We've had people in to teach us how to clean the center line, one of which has been removed. We've had people in to teach us about all the drugs and the administration of the drugs and the order and all that stuff, and someone to talk about nutrition, although frankly we probably know more about nutrition than this nutritionist they sent us, but that's all a separate conversation. So yeah, still feel like crap, but looking forward to being home, being able to sit out on the deck, sleep in my own bed, shower when I feel like it, my own shower. Although today's shower day here, so I'm looking forward to that, as I always do. And just generally, feeling better. The numbers continue to recover. The physicians are convinced that I've got engraftment going on, so that's very positive. Well, head home tomorrow, be back next week for checkups, and back weekly for checkups for quite a while, and then looking forward to day 100, which is, I think, January 4th, which is an important milestone for GVH, graft versus host disease, and start getting some of my childhood vaccinations again, seeing how that goes, just getting stronger. I've lost, I came in at 187 when I came in, 77, I'm down 20-something pounds. No surprise from not eating. I think it was 167 today. But I had some reserves there, so no worries. But yeah, build strength back up, get walking more than just the limited walking I could do for these 25 days here. and get back to living. That's the plan. So we'll do another video tomorrow. But for now, that's it. Signing off. Tuesday, October 15th. Day plus 19 from Transplant. And it's go home day. Yay! Go home day. So Peggy's packing up. She's kissing me through the mask. It's a new thing. So got my stuff packed up. And Peggy's making the first run down to the garage.
For you?
And for me, yeah, she's already done her own, having checked out from the hotel. So yeah,
I gotta get my steps in today.
she's going to get her steps in today. I might even get more than the steps that I normally get in a day, so that'll be good. But yep, go home day. Good day.
Yay.
Yay. Okay, it's really go home day.
I hope
So-
we never come back here again. Not because of the people.
Yep. So we are headed home. Doo-doo. Mask kiss.
I love you.
Love it too. Here we are doing the walk from the Brigham back to the Dana-Farber. And then over to the parking garage. This is the bridge, sort of looking up at where my room was. Turn onto this other bridge. So yeah, my room was right up there. I don't know if you can see through this or not. Whoop, we're going home.